Okay, good morning. I'm still trying to get up to speed with the etiquette of webinars and calls and things, although I think we are getting there. It's 11, so I think what we'll do is we shall start. This is a webinar we put together because, unfortunately, as we know, there is no digital healthcare show this year. So with our digital healthcare partners and BCS, within this quick webinar this morning, it's going to be about our intention is between half an hour to 45 minutes around the topic, which has what has changed in data and AI in light of the coronavirus outbreak. So if you're attending a webinar to fix your shed, you're probably in the wrong one. So just to make sure that we're all understanding what the topic is and what we're going to be talking about this morning. We have Niamh McKenna, who is going to, from Accenture, who is actually the brains behind this webinar, who's going to talk a bit more in detail about data and AI, and I'm going to try and facilitate and try and bring some of those insights out as we go through. There's also Simon, who is running the webinar in the background, who is going to be able to coordinate any questions that come in from people and put those to Niamh and myself. So if you hear a dismembered voice in the background, don't worry, don't panic. That's just Simon, who's doing his job looking after the webinar. I should say my name is Adam Thilthorpe. I'm Director of External Affairs at BCS, British Community Society. My interest in this space is helping policymakers make sense of advances in digital and IT. Over the past, I think what we've seen is policymaking derived from the iPad epiphany. The iPad epiphany being a politician sees their child or someone else's child being able to navigate an iPad and thinks, aha, technology is going to solve all of our problems. Tends what to happen is there's not a lot of critical thinking going on with that. And IT and AI and machine learning is seen as some sort of magic, which makes the world a better place. So if we take a load of rubbish data, apply magic, then amazing things will happen. And of course, what we're trying to do is understand that, but also help with regards to policy making around digital and advances in technology, which is no easy thing to do. That's what I do. I do quite a lot of speaking for the BCS on some of those topics. I'm also part of the Federation of Informatics Professionals. I sit on the board there, trying to get recognition and professionalism embedded around health informaticians and those people who are frontline workers, which is great to see the Secretary of State acknowledge the fact that what's happening with NHSX and NHS Digital being incredibly important, especially as we battle this topic. Before I ask Niamh to answer the question, maybe if I could ask Niamh just to introduce and say a little bit about herself, if I may.
So good morning, everyone. Thank you very much, Adam. So my name's Niamh McKenna. I look after Accenture's healthcare practice in the UK. So all the work we do, both in public, which is most of the work we do, and also in private healthcare. But my background is many years in technology. So I suppose I bring with that quite a deep interest in technology, and a bit like you were saying, Adam, I have a personal passion for very practical applications of technology, and how we can get technology to kind of solve perhaps lots of small problems rather than the magic wand, as you just described. So really fascinating topic today, and it was really interesting. Yesterday, I was just spending a few minutes preparing for this webinar and did just a quick Google on I think I did something like AI COVID cure, and not hundreds of articles came up, and articles in places like Wired and Forbes, saying AI is basically going to help find the cure. It's going to help find a vaccine for COVID-19. And of course, so one of the things that has changed is I think the way in which we're now looking to these technologies, and AI is just one example, but we're looking to these technologies to help us because we don't have a playbook. We don't know exactly what to do and how to do it. And that, I think, if anything, this particular pandemic has really sort of shocked everyone in a way because of the global reach, because of the impact, and because we don't know exactly what the best approach is. We look at all the different countries and they're all trying, flavors of the different things. We were talking about herd immunity. Sweden has a lighter lockdown. Some countries have very severe lockdowns. No one knows exactly what to do. And in these situations, then it's very tempting to turn to technology and say, right, come on, tech, tell us what to do, or tell us how to do it, or come up with an answer. The challenge we've got, I think, with all of this, and I was reflecting actually on our we do a technology vision every year, and one of the themes we talked about this year was AI and me, and about this concept of AI being something that goes only with human collaboration, and how you need to prioritize things like explainability when you're creating an AI to do something. AI is just a mirror. It's a mirror on our world and our data, and isn't actually going to be able to provide the answers on its own. And the big challenge we've got, of course, with this current situation is we don't have endless data sets, big data sets that are lovely, organized and clean from previous epidemics. So we don't have enough historical data to be able to train AI to help us explain how to deal with the pandemic or exactly the progression of this disease. And of course, AI is merely trained on data. And if you don't have that data and you don't have people who can guide, provide those guardrails for AI, it's not going to come out with good answers. So I think there's a big challenge actually, where we're trying to rely on some technologies, but these technologies, I think in the world of vaccines and cures and answers, I think it's quite problematic to rely on this.
Okay, there's something in what I think we have to do though is for a long time we've been talking about these technologies. If I go back, I'll take a blunt example. If I go back a few years ago out on the speaking circuit, if you worked for Google, you were getting £2,000 for a 20-minute keynote presentation. I think that was about the going rate. It was quite a long time ago, and it was there won't be a global pandemic because just by utilizing people's search data, we'll be able to, just by looking at people's search data, we will know before people even know when they get sick, and these things will bubble up. And this was all part of a big technology sort of presentation, a promise, if you like, that these technologies and the application of these technologies is actually going to solve and enhance human experience. And it's going to provide these answers. And I think what we've got to do is try and balance, as we said at the beginning, this idea of hope, that technology allows us this hope and this promise that we can make the world a better place. And actually people are looking at, in light of COVID-19, are looking at technologies going, well, go on then, this is our time. This is the time for technology to step up and provide some of these answers. Is that just too unfair, or do you think there is still hope in that we can utilize and use some of these technologies to help us get ahead of COVID-19?
Well, I think we could definitely make some really good use of those technologies. And actually, interestingly, there was a company called Blue Dot who actually notified, so using AI, notified about the possibility of COVID in December. But the problem is we didn't know at that point that we should rely on that. So it's back to that point, whereas you can't have that technology operating in a bubble. It's got to be with an intelligent human who helps try and work out whether or not to make sense or whether or not to use that. But I think there's some really good and clever applications of AI that will really help. I mean, there's a couple of ones. I think it's FarmNext is one, but there's a few others who are basically mining out of patent drugs information to see if there's a drug out there that might be able to help in the situation for COVID. And what you can do is fast track through the process, because if you take a drug that's already been approved and you're now reapplying it to something else, that is a great way of using AI, because it can churn through data much faster than any human can. And what it can do is throw up some stuff for then a human to go away and look at. So those kinds of data mining research areas, I think, are a fantastic application for AI. And the other thing, of course, is we can use, applications of AI that are in use today, things like voice, to help us, through the pandemic. So, for example, 111 is absolutely snowed with calls. I think I was speaking to one of the leaders of 111 in London. They were saying something like it's 20,000 calls where normally they get 6,000. I mean, it's just exponentially off the scale. Could you use AI, voice-driven AI, to help talk people through, actually what is a fairly straightforward sort of set of, have you got these symptoms? If so, then this is the process you need to follow. So are there ways we can relieve burden on the system by using AI or, AI-powered chatbots or things like that to help us navigate this pandemic in a slightly better way? So I think there's absolutely applications there. There's also some great applications, just very straightforward administration burden and things like that you can do in hospitals. So I think there's an absolutely good role for things to play. I think it's the sort of panacea of, we'll just click a button, a machine will churn through a bunch of data and out will pop a drug, I don't think will happen. That might happen one day in the future, but not now. And so I think if we can concentrate on the really practical stuff that actually will just relieve burden, and then maybe not quite worry so much about the drug.
Okay, so there's pressure in the system in that people understand that data is the key to utilizing AI. I mean, there's an acceleration of demand, if you like, for good quality data to allow technology to do its thing. I'm mindful whenever there is this pressure in the system. If I look at a less emotive example, is sort of 5-10 years ago, companies realized that data was king, and so they started this huge accumulation of data, so that when you went on and bought a nothing postcard, you had to put in your date of birth. So it was incredibly important to make that purchase that they knew as much about you as HMRC did for some bizarre reason, or your bank. And then, of course, companies realized that was the accumulation of that data was actually a huge risk. It represented a corporate risk, holding all of that personal information. We know that with healthcare information, which is of course incredibly personal, but also in this emotive situation with COVID-19, it's likely to be able to unlock the answer. What are the risks? What are the risks, especially around unintended consequences of some of the things we're seeing in this rush to get to data? But with the best intentions, what do you see? Because sometimes we're sort of mused at the beginning that policymakers and our policy-making infrastructure is based around a sort of 1850s view of the world and worked very well in that context. But the acceleration of technologies requires, if you like, a different ability around policymaking, different level of understanding around technologies. What, therefore, do you think are the risks with regards to the sort of AI is the solution, just give them all the data? Where do you see the problems in that?
Well, I mean, I think, as you quite rightly said, there are, AI is as good as the data that you feed into it, and therefore inherently we run the risk of introducing bias unwittingly into a system without realizing it. So we take data from a hospital or data from China, and that's going to have bias, not bias in terms of intentional bias or whatever, but you're saying, well, those people in that demographic around that hospital or people in that country may exhibit different results, different data, may have different characteristics about them than the population I'm trying to look after. And we've seen that time and time again. There are some very famous cases of bias. I mean, the Optimal algorithm is one where they were very biased against African American reasons in healthcare. for based on socioeconomic data, and COVID's going to throw up the potential for all this misleading data, because we don't have a lot of it, and because we're working so fast to try and, so are we, we see things like higher mortality rate in men, but is that due to the fact that men are more likely to be smokers, or because men have some other characteristic that we're not sure about? It's so hard at this juncture, I think, to react quickly enough and for the human to guide it well enough. Because in order for us to eliminate that risk of bias, a human's got to kind of, try and adjust for that. And we as humans don't know enough about that data ourselves. And so I think there is a big risk. There is great opportunity, as well, because what AI is wonderful at doing, which we as humans are bad at doing, is we introduce loads of bias ourselves when looking at data sets. And AI can sometimes spot links that we can't see. And so there is the opportunity there to perhaps create some correlations. Because we have all this data, they might spot a correlation that we might never have come up with, and an AI can do that. And you can even use, Salesforce Einstein's an example of that. You can even use AI to help spot biases in your data as well. So it's a very multi-layered thing, and I think the problem is it takes time to actually go through, get the data, cleanse the data, look at the data, run it through an algorithm, check the algorithm. That just takes time.
So I think we're sort of moving towards an understanding where AI is quite good at calculation, but less good at judgment. Would you say that? Is that a fair analysis?
Yeah, I think so. I think it's really useful to be able to use it in that way. I think the judgment part is obviously the hope for AI. I think that correlation, but causation continuum is just a really difficult thing to navigate, and I think it will take us time. And we see that time and time again with AI. It is really good at spotting correlation in ways that we sometimes can't do, but that causation factor is not always as straightforward.
Yeah. With these things, with global pandemic and other crises, often that's a driver for innovation. Are you seeing at the moment an adoption of AI in ways, maybe in practical ways, that previously hadn't happened? And is that extending? We're seeing a lot of GP surgeries now, sort of instead of a 2-year rollout of becoming comfortable with sort of video chats and Skype calls and all the rest of it, suddenly it happens sort of in about 48 hours. Are we seeing similar advances in this technology with regards to healthcare?
I think so, and I think we're going to see, in so many ways in healthcare, we're never going to be the same again, because some of this progress that we're making, virtual consultations, a great example, is there's probably just no going back to where we were. It's not going to remain at the level it is today, but it certainly won't go back to where it was, 6 months ago. But again, with the AI, so some really great examples, and examples where I think AI really plays a great role. We've been working with the Italian government on some social listening. So that's trying to use AI to help look at, social listening data, things like tweets and Facebook posts and so on. So things that are publicly available, matching that with other information that we're getting from the government to say, actually, we call it nowcasting instead of forecasting. It's saying, you've got a problem right now over there. There's an outbreak happening, or there's pressure on a system over there. There's a bunch of people trying to turn up to A&E, whatever it might be. You can use that. We've been talking about doing that, and we've done some small proof of concepts. We've done some small proof of concepts with various governments and various organizations over the past probably almost 2 years, and suddenly everyone wants it. So things like that, again, have just accelerated from 0 to 100, super quick, and that's fantastic. So we can definitely see people saying, great, let's use this. Can this help? Can this help me? I need help. And I think we're definitely seeing applications of AI in that way.
So in a post, God willing, in a post COVID-19 world, so rather than, I think it's a great opportunity, rather than going back to where we were, we want to go to where we want to be. And what does that look like? If we're back to this sort of Google keynote kind of thing, the art of the possible, what does the NHS look like, do you think, with regards to a fully integrated sort of technology, AI, machine learning sort of set in there? What are the key differences? If you had the ability to embed the technologies and everything else that you see, what would that look like?
So I think, the big thing about the NHS and data and AI is there's great hesitation for, very valid reasons around the care.data and, national programs and all of those kinds of things. People get very worried about sharing data. I think what we have seen during this pandemic is that there's an urgency to share data, and actually that will drive better outcomes. And so the amount of integrated data that I think we'll see in a year's time and 2 years' time, I think people will push those boundaries a little bit further than they have been doing, and they'll be a bit braver about pushing the boundaries with the appropriate safeguards. So, I'm not all for, throwing the data out there, caution to the wind, but I think it has been too cautious. And government agencies, healthcare agencies, different parts of the system are now, being more open about sharing data, and that data will unlock potential. I definitely think we're going to see a big change in research, because I think, again, this urgency for research to give us answers and the progression that you're seeing in terms of the collaboration of the different parts of the system, academia, pharma, etc., I think we'll see a big change there. And then I think an acceptance for people to have recourse to automated systems to help them in different ways. So, be that a Babylon style, chat bot, or a voice that's automated when I pick up the phone, guiding me through perhaps triage level 1, or a WhatsApp chat, whatever that might be. I think we have, as consumers, perhaps always had, because our healthcare system is free to use, we've been more reluctant, I think, to embrace some of those technologies than they have in other countries. And so I think that will just push us a bit further along that acceptance curve and say, well, actually, it is terribly convenient to interact offline or do something virtually. Or actually, I get quite a good answer out of that chatbot, and I can do that at 3 o'clock in the morning without having to try and wait for a doctor to call me back. So I think we'll see quite a change in terms of how we approach healthcare in so many different ways. And it's not just about the AI or machine learning. I think it's going to be about all of the aspects, virtual consultation. Some of these things don't require anything like the technology that AI brings, but I think we'll definitely see that. The one I think I'd like to see, and I'm worried we're not going to see enough of, is automating administration burden in the clinical setting. And if we could do more of that, I think that would be a game changer for the NHS, because if you think about the percentage of time that people are having to do, relatively trivial automated tasks. I was talking to someone, and they were explaining how they had to rekey a bunch of information from one system to another system. That sort of stuff. I mean, and that's not even AI. That's just, relatively simple robotics. That stuff we absolutely should be pushing on. But I think it's hard to prioritize that in the pandemic. But that's the one I wish we would spend a bit more time on.
Yeah, and why touch a keypad when you can speak and it can anyway, there's all sorts of things like that. You mentioned trust in there, and I'm wondering, so in this world, in this vision of this this sort of integrated, I wonder a few things. I wonder about trust of government, not this government, but the machinery of government. isn't very good at sharing and being transparent. You know, it's a good example actually is we get a lot of volunteers coming through. This is a new thing for government to actually work sort of in partnership with society to deliver solutions for the benefit of society, if you see what I mean. But that can be scaled so much more when it comes to data and AI and all the rest of it. So government doesn't have the institutions, if you like, that enables that cross flow of information and data and sharing. And does the public, maybe it does post the pandemic such as this one, have the appetite for that trust as well? You mentioned a few examples, you know, care.data and others, where the intent is absolutely right. It's just the execution is so difficult because there's the institution of itself that's trying to do the sharing, and then people's attitudes towards that. Not even mentioning those there's several million in the UK who have yet to be online. And often they're the most vulnerable and the people who might need the NHS's health and social care support the most. So there's a few things in there, I think, around trust and the linking of trust and verification. And the attitude has always been, we need to move to an attitude, I think, differently in the public where I agree that we've got, you know, an individual might have nothing to hide, but everything to lose. When it comes to us, these things are freed up. And also AI might not always have the solutions, but I might want to donate. I may wish to, a good example, I may wish to donate my data to an institute like Cancer Research UK. I might actually have, I know that my personal data has a value, and therefore I choose to donate my personal data in an anonymised fashion as much as possible to Cancer Research UK so they can continue their research to ultimately solve cancer. At the moment, I feel like people might have a relationship with Cancer Research UK more willingly than they do with the infrastructure of government. Do you see that's a problem, and do you see what sort of solutions? Because if it's in everyone's interest, would government legislate when it comes to sharing of data? And would that result in a backlash? How do you see the how do we deal with people in amongst all this?
I think it's that's a really good question, and I'm not sure I have the full answer. I mean, my view is, I think people in times of crisis, people start looking for the grown-ups and the people that they can trust. I think governments have had to step in.
Good luck in America, by the way. But anyway.
Yeah, and only time will tell actually whether we feel that they were trustworthy, because I think that's an assessment that people will have. We have no choice but to trust the government's approach to lockdown, ventilators, whatever it is. We have no choice at this moment but to trust it. But time will tell whether or not they were trustworthy. I hope that they will be proved to have been trustworthy and have been open where they have needed to be, because actually you can't solve this just with NGOs or third sector or private companies. We've got to have a machinery of government, and as you say, it's not about a political orientation, it's about a machinery of government that can engage and understand and be trusted by the public and share data in an appropriate way. Because as individuals, not only is it very hard for us to make those decisions, but often we make very poor decisions. You think about the number of times you're like, oh, but I just want to download this app. Click, 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 click. Yes, whatever. I'll give you this, that, and the other. And then we discover a year later, 2 years later, that our data has been used or has been shared, and we didn't know, and we didn't really understand. So I believe there has to be a role for government to play here that effectively controls how we're sharing our data and has some of that macro data set, and particularly in a national health system. I think it's, we get the benefit of this for free. I feel there's a legitimate requirement to have my anonymized data. Doesn't need to be personal to me, but to have my data used for the greater benefit back to the system. I think that's a fair exchange, personally. So I think there's a need for that. I couldn't call it, because we've been here before, and as you say, with the best of intentions, it's not turned out that well. So I'm not sure if we will get there, but I would like to think we can get there, and that we can be very grown up about our data, how we're sharing it, the transparency about which it's been shared around the system, what it's being used for, and that we don't end up in this weird situation where we either didn't realize things were happening, or worst case, then our data gets aggregated and sold somewhere else, and then sold back to another part of the system, which kind of always seems bonkers to me.
Yeah. And that's again is sort of that awareness and sort of unintended consequences scanning that's a requirement of this. And that's a skill set I think that's required of modern leadership.
Mm.
What do you think? What is the minimum requirement, do you think, for leaders in the health service, policymakers in broader government, to be able to unlock the potential of some of this stuff? I'll give you a quick example where you think of it. Back when we used to talk about Brexit until the cows came home, the Chancellor, the then Chancellor, said that we didn't need to worry about the backstop problem in Northern Ireland because of blockchain. And sort of, we all did that. We all sort of sniggered a bit and, whatever. Now, he wasn't wrong in that blockchain could be a useful part of a system to deal with borders. Maersk are quite good at it and use blockchain as part of that solution, but it's not the magic answer, back to my original premise. But there's a skill set requirement, isn't there? Because, as you say, when you Googled it over the weekend about AI and COVID-19, you get some cool articles from Wired, and they give you a huge amount of hope that there are forces at play here that are going to find a solution and everything's going to be fine, hunky-dory. But actually, it's what level of critical thinking is required to unlock the potential of AI, machine learning, big data, blah, 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 but also balance against ideals such as privacy. Because we've not cracked it. So Facebook works very well at a personal level to organize your football team or your meetup or whatever, but it doesn't scale actually nationally. Where at national level, Facebook undermines Western liberal democracies to understand it. But personally, it's fine for me to organise a sports club. So how do we get the goodness, the promise, the hope of IT? What skill set is required? Do you think it's a minimum requirement? They're not going to be as clued up as you on AI, but what do they need to know to be able to make good decisions in this space?
So I think actually the point is nobody knows enough to make a good decision, and that's where I think we see some of that goodness happening, and I think NHSX is trying to do a bit of that, but is pulling in a diverse range of folks to get that answer together, because I don't think anyone's got the one answer. I certainly don't. I've just got a perspective based on what I see, but there will be other people out there who know far more about me on certain topics. And so what we've got to do is get comfortable with the fact that you need a much more diverse panel, and that panel has to include people from business, people from industry, people from big tech, as well as researchers, academics, and policymakers, and that kind of thing. You've got to bring these kind of multidisciplinary teams in a very modern sense together, because otherwise it just won't work. And I think historically, if we look at where policy is driven out from, it's driven out of a very relatively narrow type of person. That, if you go and meet all the sort of policy folks in Westminster, they often are quite similar. They draw upon academia quite a lot because hasn't got a vested interest in the way that perhaps business does. But actually, you need all of those. You need to hear about those vested interests. You need to hear from big companies, but also small companies. You need all that range. And it's quite a challenge because that becomes a crowd control issue. And so actually the leadership that they need is how to navigate all the differing opinions, how to get the crowd control, and how to distill out of that the answers. So in a weird way, it's a huge amount of softer skills and a curiosity about technology. I always like people to have a curiosity about technology. I want to know more because none of us know anywhere like enough. So a curiosity about technology, but the ability to listen to a broad range of views and help distill out, the goodness from that.
Okay. And do you think, sort of in light of everything that we're learning on a day-to-day basis, do you think AI is going to allow us to move into a sort of a more predictive mode? If we have a healthcare system, as you described, where that marriage of data and clinical practice, are we going to move into a different range of healthcare provision? When people ask us to describe what AI is, I like the analogy that AI provides you with better tools, which advances or moves the barrier of what is humanly possible. So if you have better nails, you need better hammers, right? So it's kind of like that. What is the hopeful vision, do you think, for unfettered improvement in AI?
I mean, I have no doubt that AI absolutely is going to be the key to unlock, the potential of prevention in healthcare. Because if I look at the, petabytes of data that's being generated every single day by all of us with our Fitbits and our this and our that's and our, all the things that we're doing, that has got to be able to help us do more prevention. If you marry that data with, our genetic data, our wellness data, our contextual data, our financial data, our socioeconomic data, there is no doubt in my mind the only way of doing that is with an AI, because it's beyond the scope of a human to do, and it has got to unlock the potential. We know instinctively that people who are better off have better health outcomes. We know that, but do we really understand why? Do we really understand what are the significant factors and what are the microscopic changes that we could make or enable that will help everybody get to better health outcomes? There's got to be a role in AI there, a really big role, and I am very optimistic that we will solve this and we will get to a far better level of prevention than we are today. Because if you think about the level of prevention today, it's still relatively a fix on fail system, relatively speaking. And we have got to be able to move to a much better preventative system. And frankly, we can't afford it. We can't afford anything else, right? We cannot afford to fix on fail, the volumes of people who will need fixing on failing as we all age and we live with multiple comorbidities, et cetera, et cetera, et cetera. So for me, it is no doubt AI has got to be the answer, and it has got to be the key to unlocking prevention.
And do you think, sort of last one from me, I don't know if Simon's trying to butt in, but he should know to interrupt me whenever he feels like it. But as we see people like Apple and Google and other tech organizations moving to greater collaboration, and let's take that out face value. So if we see, as you say, Fitbit and iWatch and phones more generally being able to collect and this sort of data, and us moving to a system where we may well allow that as part of a sort of post-lockdown move from lockdown back to normality. Do you see that as part of this hope? Because I feel that the pendulum has swung for the last few years, that big tech, sort of born out of a sort of a hippie movement in the 1960s in Silicon Valley, has sort of lost that faith and lost that trust. Just the issues around taxes. People are bored of one man band founders suddenly having a peak of conscience when they've got X billion and saying, do you know what, I'm going to help 3 schools, and the public going, well, maybe if you paid your taxes, you could help many schools, and you would have done throughout your career. So these are the companies that have the solution. But we're back to that trust issue again, where actually people used to, everyone used to want to work for Google because they had food and stuff, and you didn't really need to go home. And now, and sweeping generalization, I don't mean to pick on Google, but now people aren't quite so sure because they're not sure whether they're drawing an employer or a cult. So have we already lost the faith of people to be able to get that trust? And is that part, do you think, of unlocking that potential as you see it?
I think it is. I mean, that's an interesting question, because in a way, I think actually the other issue that these big tech companies have is they've started down this road of collecting this data, and I don't think they know what they're going to do with it. I don't actually, and I don't think they have either the skills or ability or kind of mandate yet to actually use it for the purposes that I've been talking about, which are, healthcare prevention and, preventing on a system level, people getting ill. So I think it's going to be very interesting, because I agree with you. We are losing losing a little bit of our faith in big tech, but yet we are all glued to our phones. So we haven't really lost it. We've kind of just lost a bit of it. It's a bit like, when there was this scandal about Facebook, and everyone, uninstalled Facebook and whatever, but then kept WhatsApp. And it's like, because actually I can make a stand on that one, but I really need to be able to communicate with my family via this method. So I think, that these things are becoming part and parcel of our daily lives. I think they are proving to be, on balance, more beneficial than bad. But that is where, again, the machinery of government's going to have to step in, because I don't think we can just leave it to these organizations themselves to self-regulate, to self-police, to set up the necessary sharing and collaboration to drive out that system level, benefit. And I do think, I'm not normally a fan of big interventionist government, but I think in certain cases we're going to have that big interventionist and say, actually, you can't do these things anymore. A bit like GDPR, when they came along and they said, you know what, people are signing up to things and they don't really realize what they're doing. So we're going to have to make them realize it for them, because it's not fair to push all that responsibility down to the individual. And I think we're going to see the same with all this wealth of wellness data that we've got, that we've kind of unwittingly stored in the hands of either Apple or Google, depending on which team you bat for. But someone's going to have to almost intervene and say, hang on a minute, that data is yours, and you can't just give it away and not know what's going to happen.
I would agree. I think big government is a requirement almost in a crisis, and because no one else has the ability or the mandate to do that. And I think the system approach requires the technology that these organisations can provide, but they don't have the mandate. And I wonder if post-COVID-19, what we might find is that the NHS has a mandate far in excess. I mean, it's always been a sort of a national passion, the NHS, and rightly so. But now I think it might find that the NHS's mandate has expanded somewhat. And I think we can't rely on platforms and third-party and NGOs to fill in that space between citizen and we need, if we're going to really utilise all this data, I think we have to have this trusted provision. And I think that's a new and scary place for government. And it should be a new and scary place as well for us. But somehow we're going to have to find that solution. Otherwise, we won't be able to unlock the potential and the hopeful message, if you like, of technology. We've got to find some sort of balance. As you rightly say, Facebook works individually, but doesn't scale nationally. It doesn't seem to. There's misinformation on there about COVID-19. But there is an ethical conundrum in there that only I think the NHS will have a unique mandate, perhaps around the world actually, to be able to be the guardian not only of our health and social care, but also perhaps of our most personal data.
Yeah, interesting.
And that seems like a conclusion. And Simon hasn't interrupted, and I promised that we would go for sort of 45 minutes. I feel like we could carry on chatting about this.
Yes, no, we'd be good to hear perspectives from some of the attendees. I don't know if there's
yeah, I'd like to. I don't know if Simon has the opportunity to share any questions or feedback from the audience.
I do, and thank you both. That was a really interesting and insightful conversation. So thank you very much. We've had quite a few questions come in. So
Oh, great.
I guess just following on from your last point seems a good first one to pick up on. Is perhaps the greatest challenge clinicians and patients trust in AI and AI companies rather than the technology itself?
I think you know, absolutely. I think particularly clinicians. I think patients, perhaps, you know, at the end of the day, as a patient, often we're trusting someone anyway, right? You're trusting the doctor to come up with the answer. But clinicians, I think, will need, and rightly so, will need to have, you know, as I talk about that explainable AI, they will need to have those decisions explained and understand that process for them to trust it. Now, that's not every single clinician every time, but I think there will need to have been a process by which the, you know, clinicians bless those things so that they feel secure in that knowledge when it comes up with a recommendation or a conclusion.
But that transparency is really hard, isn't it? Because it's back to our discussion around sort of calculations versus judgments. But you've got to, I think, to build that trust, the issue is to have transparency in how that decision was made. And that starts to get you into areas of understanding potentially around AI and what people need to know around that to make good decisions. So it's a key question, I think.
Yeah, I mean, we've seen it in some examples. So there are some interesting in financial services. There are some AIs that explain, you know, financial decisions around loans and things like that. So it just needs to be explained, and you can, you know, you can do it. But yes, it is hard. It can be very hard.
Okay.
Thank you. And another question is, how can intelligent researchers and frontline staff get involved more and reach companies like Accenture and others with their findings and recommendations and get involved more?
Well, ultimately, I think it's how researchers and clinicians get involved with the NHS as well. So I think, you know, we're all trying to do our best at this moment to try and support, you know, for example, the NHS. NHSX is trying to sort of coordinate all of those offers of help, and one of the things that they're trying to do, I think, is to group together groups. So we've got some for people, for example, working in very multidisciplinary teams in NHSX who are working with, you know, our colleagues, our competitors, organizations, and so on. And I think that's the best way of doing it. Because I think individually, again, my view is not one of us, there's not one company that's going to solve this. It's got to be a conglomeration of different ones.
Yeah.
Great, thank you. One question that came in is, should AI be part of the curriculum?
Probably. Yeah, probably.
So with the BCS, we're part of the coalition that runs the National Centre for Computing Education, and rewrote the computer science curriculum a few years ago, which is now taught in primary and secondary school education. So yes, and some of the principles that we already teach in there support AI, but there is more work being done. I know that Dr. Bill Mitchell at BCS is helping the Office of AI in Government with regards to postgraduate curriculum around AI, but actually what everyone needs to do. So there's two aspects. One is, you know, being great and formal education around computer science and IT and other aspects, but actually as part of digital literacy, I think we need to understand some of the sort of ethical conundrums that are thrown up around adoption, use, and advancements in technology, and some of those sort of questions around intended and unintended consequences of our actions, which I think are great things to be doing in schools. You know, everything is in there: maths, logic, geography, history. You know, so yes, that's a long answer to a good question, but yeah, it definitely should, and we are trying to do that specifically as part of our mission at the BCS.
Great, thank you. And possibly the last question, looking at the timing, how do we ensure that we exploit the benefits of AI in mental health as well as physical health care?
So really interesting stuff, I think, coming up in mental health. We did a sort of a small proof of concept pilot, for example, on people's Instagram pages to see if we could use that as a predictor of depression. And looking at the color palette changing of the pictures that people posted, seemed to have an indicator, for example, around, whether or not people were getting depressed and then ultimately feeling quite suicidal. And so there's some really, I think this is one area, because it's an area that's quite complex, again, as a tool to support healthcare professionals, mental health care professionals, it can be a useful thing, because actually in some ways people will exhibit behaviors either through what they're searching, what they're googling, what they're posting, what they're saying, and it can be a useful tool in that. And so I think AI as a way of gathering some of that data and just alerting someone, saying, I think this person's suffering, or just posting up something to say, have you considered, calling the Samaritans, whatever that might be. I think there's absolutely a role in mental health. Of course, the big challenge we've got at the moment is, I think mental health is going to be a very complex topic, particularly during this period of lockdown. People are experiencing isolation. People are experiencing quite very stressful situations at home. I mean, I know myself, just trying to homeschool 2 kids plus like work has been nigh on impossible. We're all suffering in many different ways, and so I think this is an area that we're all going to have to spend a lot more time thinking about.
Yeah, no, I completely concur. It's a great. You might argue that the data will show that post a pandemic like this, you're going to have a mental health pandemic immediately following, if not during. So, if we can harness AI to help us some of that predictive ability, as Niamh mentioned, so I think that'd be incredibly useful, and part of all other consequences that we probably haven't bottomed out yet. We still need to find out. Simon, I'm conscious of time. I think, do you want me to sign us off there?
Absolutely, yeah, that'd be great. So
okay. So thank you very much, everyone, for listening in. I hope that you found that interesting. I'd like, especially, of course, to thank Niamh for her excellent insight into this space. I hope that we get to do this again and find out, maybe post-crisis, if we can find what are the lessons learned and what did AI manage to come through with.
Well, we'll have to do it in a few years and see if we were right about anything.
Absolutely. Let's hope that that's the case. Thank you all very much for participating, and thanks, Niamh. That was excellent. Thank you.
Thank you.